So this is cool. This is a spine model. Here's your disc, and then here's two vertebrae. So the disc separates vertebrae and creates space for the nerves to come out of. So here's your spinal cord going down through the vertebrae, and then your spinal cord branches into these nerves, spinal nerves, which go everywhere in your body. They innervate basically everything in your body: your muscles, your ligaments, your tendons, your skin, your fascia, your intestines, your lungs, everything in your body. So what happens is, if you put too much pressure on one area of your disc, the disc will eventually bulge out on the other side. Use an analogy like biting into a jelly donut. Where does the jelly go? It goes out the back, right? So if you bite into the front of your jelly donut, into your disc, you're gonna squeeze this material out the back. Now it stays in the disc. So when people hear herniation or slip disc, you picture like material squirting out. That's not what happens. The disc just bulges in one direction. And the reason that's a problem is that it gets in the way of not only the joint, the vertebrae, so now the vertebrae can't close down, so you can't move in that direction, but you also put pressure on the nerve. And now pressure on this nerve causes this signal to be delayed, to be diminished, wherever it's going and whatever it's innervating. Maybe it's your stomach, maybe it's your intestines, maybe it's your rotator cuff, maybe it's your hip, but wherever this goes, that signal gets impeded, and now you get symptoms there. You get pain, numbness, tingling, weakness in the area where this nerve is going. And what happens is, in our medical field, is that we look at your symptoms, just the area where you have symptoms, which you should, but you should also look to see if there's an underlying cause coming from somewhere else. Because again, pressure here typically doesn't present with pain here, maybe a little bit, but you're gonna see more symptoms wherever this nerve goes. Now the cool thing is that just like if you put too much pressure on one side and move this material out the back, you can put more pressure on the back and get that disc to actually go back to normal and now take pressure off of the nerve. And this is what I do with patients. I figure out where they've been moving too much, where they've been moving not enough, and I figure out where there's pressure on what nerve, and now we move their spine to take pressure off that nerve, and now all their symptoms go away. This is the best way to treat so many conditions out there. But for whatever reason, we rely on medication and injections that just numbs you to your symptoms. Eventually your symptoms become worse, and now you end up getting surgery. There's an easier and better way to do this.